Hello, it is Ryan, and we could all use an extra bright spot in our day, couldn't we? Just to make up for things like sitting in traffic, doing the dishes, counting your steps, all the mundane stuff. That is why I'm such a big fan of Chumba Casino. Chumba Casino has all your favorite social casino-style games that you can play for free anytime, anywhere with daily bonuses. That should brighten your day a little. Actually, a lot. So sign up now at ChumbaCasino.com. That's ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.
Hey all, welcome back to the Real Life Pharmacology Podcast. I am your host, pharmacist Eric Christensen, and I thank you so much for listening today. As always, go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. A great little refresher, great little study guide if you got board exams coming up. Absolutely no cost to you, simply for following the podcast and getting updates as to when we have new episodes and content coming out. So again, reallifepharmacology.com. Go subscribe and get your free 31-page PDF study guide on the top 200 drugs. All right, so the drug of the day today is Zaleplon, and the brand name of this medication is Sonata. So it is classically classified as a Z drug. Z drugs are used for sedation and management of insomnia. Now, it is a controlled substance, so that's important to remember. So risk of abuse, addiction, dependence is there with these medications. So with Zaleplon, definitely it is ideal to use this medication very short term, for short-term insomnia issues, not long-term. Mechanistically, the drug binds GABA and the benzodiazepine receptor complex, and ultimately what happens is it potentiates the effects of GABA, which, if you recall, GABA, it is an inhibitory neurotransmitter in the brain particularly, and obviously that's going to cause those sedative type properties, which is what we're looking for when taking it for insomnia. From a pharmacokinetic standpoint, the onset of action is going to be less than 30 to 60 minutes, so it works quickly, and so obviously we're going to be dosing that medication at night for sleep there. Dosing ranges in the 5 to 20 milligrams range. And obviously, in my patient population, geriatric patient populations, if we have to use it, we're going to be looking on the lower end, obviously, of that dosage range. And smaller patients, you may use a little bit lower dose as well. But in general, my theory is always to kind of start low and go slow with a drug of this type, if it absolutely has to be used. Now, I always encourage folks to utilize non-drug interventions when it comes to insomnia, and you can obviously do a quick Google search and get some ideas as far as strategies to employ prior to going to the medication cabinet. So that's really important, I think, to remember and encourage. It's not what patients want to hear, generally, but if you can frame that and really encourage doing a lot of those non-drug interventions before even considering medication, that is the best strategy, because certainly these medications like Zaleplon have plenty of side effects. So with that, common adverse effects, the sedation and the, kind of hangover sedation into the next day, that can happen with these medications. With that, sedation is going to come, that loss of mental clarity, potential for dizziness, in geriatric patients, maybe confusion. So there's plenty of risks there that can happen with a drug like Zaleplon. In addition to kind of those CNS depressant effects, we've got to remember that there is a boxed warning for abnormal sleep behaviors. So if your patient reports abnormal things happening while they're supposedly sleeping, definitely consider that a drug like Zaleplon, if they're taking it, could be contributing to that issue. Same thing if you've got access to the spouse that's maybe there on their visit, or you're talking to them both, and one of them reports food missing, or the car was moved, or something wacky happening, and they can't figure it out. Certainly sleep walking, sleep driving, sleep eating, those have all been reported with these type of drugs. Again, not incredibly common, but it's really, really important that we tease that out and make sure that that isn't happening, and obviously putting our patient at risk for serious consequences due to that. I mentioned it being a controlled substance, so risk of addiction, dependence, that's always in the back of my mind when using these drugs, that folks can get dependent upon them. And then in my patient population, geriatric patients, it is on the Beers list. So risk of falls, delirium, issues when driving, that sedation and lethargy, causing potential for motor vehicle accidents, all big issues with Zaleplon, and why the medication does show up on the Beers list for sure there. And as always, whenever I see a new medication being used for insomnia, I always look at that medication list and say, hey, are they on any stimulant type medications? Did they recently start a new medication that's causing insomnia? Really, really important to do that, because we don't want to add another drug if we don't have to. And if we can maybe alter another medication that's causing sedation, whether it's taking it too close to bedtime, or whether it's, I think of diuretics, for example, causing the patient to get up and have to go pee. Maybe that's dosed too late in the day. Maybe they started a stimulant kind of off-label for rehab purposes. Maybe they've changed their lifestyle. Maybe they're doing more caffeine at night. So there's lots of possible reasons for why a patient might complain of insomnia, and a lot of them can be attributed potentially to medication. So important to do that history and make sure that we're not causing insomnia by using other medications or lifestyle changes that have occurred with the patient. All right, so let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material like NAPLEX, geriatrics, pharmacotherapy, ambulatory care, medication therapy management, or the psychiatry exam, definitely go check out meded101.com/store. We've got a growing list of resources there, complete packages to help you prepare for the entire content outline of those exams. Again, meded101.com/store. If you're a nurse, med student, PA student, nurse practitioner student, or a practicing clinician, definitely go check out meded101.com/store. We've got a growing list of Amazon books, also Audible books as well, and you can get your first one for free by clicking on the link there at meded101.com. So lots of different books, from polypharmacy to drug interactions to books on case studies. And again, most are very highly rated on Amazon, and I think people find a lot of benefit from those books. So again, meded101.com/store. You can find links to everything we have there. All right, so wrapping up drug interactions, first most obvious drug interaction is additive CNS depressant effects. So, alcohol, opioids, older antihistamines like Benadryl, Atarax, trazodone, any medication with sedative properties can have additive sedative properties when Zaleplon is used. And I think I've discussed that numerous times in the past there. And then the other drug interaction that I have kind of in the back of my mind, it's definitely not at the forefront, but at least in a minor pathway, CYP3A4 interactors can potentially impact Zaleplon concentration. So CYP3A4 inducers can potentially lower concentration, so your classic St. John's wort, maybe carbamazepine. Those can lower concentrations of Zaleplon, and CYP3A4 inhibitors may have some modest effects on increasing concentrations of Zaleplon. Again, probably not crazy high on my list, but it is something to maybe think about if something unusual is happening, or you started a new drug and now they're experiencing a lot more sedation, or maybe they're experiencing a lot less sedation if it's a CYP3A4 inducer. So, all right, with that said, I'm going to wrap it up for today. If you enjoyed the podcast, leave a rating review on iTunes. Share us with your class, your colleagues, your students that work with you. Definitely help share this resource with those other healthcare professionals. Hopefully you picked up a few pearls today. If you want to reach out to me, mededucation101@gmail.com. Or you can find me on LinkedIn, Eric Christensen, PharmD, BCGP, BCPS. And that's going to wrap it up for today. Thank you so much for listening, and I hope you have a good rest of your day.
Hey guys, it is Ryan. I'm not sure if you know this about me, but I'm a bit of a fun fanatic when I can. I like to work, but I like fun too. It's a thing. And now the truth is out there. I can tell you about my favorite place to have fun. Chumba Casino. They have hundreds of social casino style games to choose from, with new games released each week. You can play for free anytime, anywhere. And each day brings a new chance to collect daily bonuses. So join me in the fun. Sign up now at ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.